Thank you very much. Well, it sounds like one of the most painful things you can experience. And this is how it's described: an organ protruding through the wall or muscle or tissue. But something simple like coughing, pregnancy, or lifting something heavy can actually cause it. Dr. Wynn Matthews joins us now to talk about this morning. He is a doctor over at Princeton. Dr. Matthews, good morning.
Good morning.
So I think we all have heard someone talk about a hernia, but a lot of us really don't understand exactly what it is. So explain what happens a little bit more than that description I gave there on the outset.
Well, that was a pretty good description. So a hernia is basically a defect, and it's usually in the abdominal wall or in kind of your abdominal cavity that opens up through a normal tissue plane or through a known defect, say like the inguinal region or and where your esophagus comes into your abdominal cavity in the hiatus. And then it usually becomes a problem when it either gets big enough to allow another organ or a piece of bowel to get through there, or when it causes pain. So it's basically a defect in a normal tissue layer.
And so I know it can happen from either an injury or even after a surgery?
Yes, ma'am. So the most common cause of hernia kind of in the United States, other than a congenital, say most people have a small hernia where their belly button is, and it can usually get bigger and cause a problem. The most common cause other than that is actually surgery. So whenever we make an incision and violate the abdominal wall, if you decide to go pick up something heavy a couple days after your surgery, you can increase your risk of getting a hernia that way. Yes, ma'am.
So what do people normally, can it go undiagnosed for a while, and what symptoms are people having before you diagnose it as a hernia problem?
A lot of these can go undiagnosed for quite a long time. It depends kind of on where the hernia is. So if it's, say, on your anterior abdominal wall, maybe you've had a surgery or something where your belly button area is a little bit distended. If it doesn't really cause pain and it doesn't hurt you, then people are not going to notice. You usually have to get fairly big, or you actually have something pushing through there before you kind of go seek treatment. So these can go undiagnosed for quite a long time.
So you can maybe go undiagnosed for a while, but once you start having that issue, the protruding, that can't last, obviously, and that's when it could become a very serious problem.
Yes, ma'am. So the whole reason we fix these is the fact that if they get large enough, you will get something stuck in it. And it's usually a piece of small bowel or part of your colon that gets stuck in there. And, in the beginning, you can maybe push it back in, and it doesn't cause you too much pain. But eventually, it gets stuck and it gets strangulated or incarcerated is what we call it, and that becomes a surgical emergency. And so our job is to... Oh, I'm sorry, go ahead.
No, I was going to say, you mentioned a surgical emergency, but in fact, that is the way you treat it, right? By surgery?
Yes, ma'am. So part of our job is to diagnose and treat these before they become a surgical emergency. That way we can treat it in a normal abdomen without bowel that's been compromised, and we can fix it before it becomes a problem.
So if it does become a surgical emergency, what's happening to the person?
So if you have a strangulated or incarcerated hernia, and these happen in the groin and the anterior abdominal wall for the most part, you're going to have a very tender hernia area. You'll have a bulge that's protruding that is not be able to push back. The area is also rather red or indurated and very tender to the touch. You may be running a fever, you may have nausea and vomiting. If you experience any of those symptoms, I would encourage you to go immediately to the emergency department.
Are anyone's more susceptible than someone else, or is it totally from an injury or surgery and just can happen to anyone?
Men are slightly more susceptible to have these hernia defects, and smokers are much more susceptible. Men have normal, in the inguinal region, they have a normal area there as part of development, and where they get inguinal hernias a lot more. And then smoking actually decreases your tissue's ability to heal, especially after surgery. So we see hernias a lot more in people that smoke.
All right, as we wrap up, aside from the smoking, and you can't help if you're a male or female, but what else can someone do to maybe try to avoid this? Anything?
So be careful when you're lifting heavy things. Always, practice safe lifting guidelines, lift with a partner, things like that. And other than that, some people just have a congenital thing that comes along with it. So just kind of go to regular checkups with your doctor so we can catch it before it gets too bad.
So lift So lifting is a lot more than just worrying about your back, sounds like.
Yes, yes, ma'am.
Yeah. All right, Dr. Wynn Matthews, thank you. Thanks for being with us today and very informative.
Yes, ma'am. Thanks for having me.
All right, take care.